Parents as Teachers' vision is that all children will develop, learn, and grow to realize their full potential. Our program supports families prenatal through kindergarten, and we do this through our two-generational approach reflected in our mission to promote the optimal early development, learning, and health of children by supporting and engaging their parents and caregivers. The values of Parents as Teachers National Center, identified by staff, are community responsiveness, learning and growth, relationships and integrity, and accountability. Parents as Teachers National Center is the model developer. We oversee research and learning, establish fidelity and quality standards, deliver training, develop curricula, provide implementation guidance and support to affiliates, and facilitate measurement of impact and continuous quality improvement. We engage in advocacy and advance policy on issues impacting families and children, guide branding and communications, and cultivate funds to support the work. We operate a direct service arm with families in St. Louis. And while our headquarters is in St. Louis, we have staff all across the country. Parents as Teachers National Center is guided by a comprehensive strategic framework. You can find it on our website. Just look for the button on the landing page that will take you right to it. An important part of our strategic plan is our partnerships. One of our key partnerships is the National Alliance of Home Visiting Models. The Alliance is a collaboration of 10 national early childhood home visiting program models that seeks to provide prenatal and early childhood intervention through evidence-based home visiting on a national scale, making early home visiting an integral service in all communities. Together, Alliance members identify cross-model issues that affect outcomes of interest, potential research collaborations, and advocacy opportunities. In addition, Parents as Teachers National Center has a number of research and learning partnerships with universities, as well as evaluation and research companies. While at the local level, communities have a variety of funding sources. There are two main funding streams available nationally. The first is the Maternal, Infant, and Early Childhood Home Visiting Program, administered by the Health Resources Services Administration. The second is the Family First Prevention Services Act through the Administration for Children and Families. And then there are the professionals and organizations that make up the Parents as Teachers family. Affiliates are those implementing our evidence-based model, meaning they adhere to our fidelity and quality requirements. Curriculum partners are organizations like Early Head Start and Missouri school districts that use our curriculum within the requirements and standards of their funder. Curriculum subscribers are professionals trained to use the Parents as Teachers curricula in their own work to support families and children. Lastly, are individuals that come to us for professional development. Here you can see the total overall reach of affiliates and curriculum partners for our last program year. There is a robust theoretical foundation underpinning the Parents as Teachers model. This includes systems theories like ecological systems, family systems, and the life course approach. Interpersonal theories like social cognitive, social support and attachment, as well as tenets of child development and attribution theory. Intrapersonal theories like stages of change, self-efficacy, goal setting, and empowerment. And we work with families first and foremost, considering Maslow's hierarchy of needs, and utilize the strengthening families approach. Home visitors, referred to as parent educators, integrate and apply these theories through the fundamental Parents as Teachers approach. Partner, facilitate, and reflect. Our model is comprised of 4 interactive components. The first component, and often what we are most known for, is personal visits. We call them personal visits because we meet families where they are, both on ground and virtually. While many visits happen in the home, they may also occur in a shelter, community center, or park, for example. The second component is health and developmental screenings for the child, caregivers, and family. The third component is resource referral. Affiliates have a network of community partners that they refer families to for support, including food banks, diaper banks, shelters, and mental health services, just to name a few. The fourth component is group connections, where families come together to interact and engage with each other around topics of interest. Parents as Teachers engages the entire family in the program. Within the four service components, parent educators focus on three main areas of emphasis: parent-child interaction, development-centered parenting, and family well-being. Child development and parenting behaviors are addressed as well. The day-to-day work of the National Center supports the Parents as Teachers family through robust training and professional development and comprehensive research-informed curricula. Model replication guidance and technical assistance is provided to all affiliates, along with a program record-keeping and data system. Our curricula are used by all of our customers. This means that not only is it used by affiliates implementing the evidence-based model, it is used by home visiting professionals in other models as well. The National Center on Early Childhood Development, Teaching and Learning's Curriculum Consumer Report rates our core curricula highly across the 15 criterion you see here. Parents as Teachers' evidence-based model is backed by nearly 40 years of independent research, with 10 randomized control trials and 25 outcome studies. In addition, the model has received many evidence recognitions in the United States and internationally. For many years, the Parents as Teachers model had four main goals. While these remain relevant and important goals, more recent research and evaluation findings about the impact of the model led to the addition of three more goals. Let's take a deeper dive into each goal. The first is to increase parent knowledge of early childhood development and improve positive parenting practices. Research found that parents who participated in Parents as Teachers were more likely to feel confident in their parenting, be sensitive toward their children, read to their children, have more books in the home, take their children to the library, have a safe home environment, and be involved in their children's school and education. These positive parenting practices are vital for children's development, especially in stressful times. The second model goal is to provide early detection of developmental delays and connection to services. Annually, our network identifies approximately 32,000 newly identified developmental delays or health, hearing, or vision concerns, and 81% of the children referred for further assessment or follow-up receive services. The next goal is to increase children's school readiness and success. Research on Parents as Teachers has found that children that participate demonstrate better adaptive behavior, high levels of self-control, higher scores on cognition and language development, higher vocabulary, improved communication skills, specifically talking and listening, better performance on third-grade standardized tests, and lower absence and suspension rates. The fourth goal of the model is to prevent child abuse and neglect. Research has shown that parents and caregivers that participated in Parents as Teachers demonstrated better safety practices in the home and were less likely to have any maltreatment reports. One study found a 22% decreased likelihood of substantiated child maltreatment, as measured by Child Protective Services maltreatment data, and a lower likelihood of CPS re-involvement. Lastly, parents at risk for child maltreatment reported positive changes in the protective factors of children's social-emotional competence and parental resilience. The next goal is improving parent, child, and family health and well-being. Parents as Teachers interrupts harmful effects of early life stress on young children's brains and has long-lasting positive biological effects as evidenced by DNA from cheek swabs on children at age 3. Data shows that children enrolled were 5 times more likely to be fully immunized and more likely to meet American Academy of Pediatrics well-child visit recommendations. Studies have also shown that enrolled children show better self-control and adaptive behaviors like less nighttime bottle feeding and better nighttime sleep. Parents as Teachers with an added focus on health has shown improved dietary intake, knowledge, and parental modeling of health behaviors. Other studies have shown less parental and family stress and increased awareness of health and safety hazards. A 6-month finding from an RCT in Arizona found parents enrolled in services had both increased and higher HOPE scores. HOPE has been crucial for parents in building resilience against stress and uncertainty. maintaining a hopeful outlook can positively affect the entire family dynamic, promoting a more supportive and nurturing home environment. Next is to improve family economic well-being. Research shows participating caregivers, particularly mothers, are more likely to gain employment and enroll in high school and college. Further, mothers with less than high school education who participate in Parents as Teachers experience significant improvements in outcomes related to family economic self-sufficiency, parenting, and child development relative to those with the same education level who did not participate in services. Overall, families showed a significant increase in education and achievement at 6 months. Lastly, a study conducted in Michigan evaluated the impact of a targeted initiative to increase usage of the Earned Income Tax Credit, which has a protective effect against adverse childhood experiences, yet approximately 1 in 5 eligible families don't receive it. This study found that Parents as Teachers combined with training for home visitors on the tax credit resulted in an increase in caregivers' awareness, application, and receipt of the tax credit, along with decreased neglect. The last model goal is to strengthen community capacity and connectedness. Research on Parents as Teachers has found increases in referrals to community resources, connections to referrals, and increases in social support. Additionally, families enrolled in Parents as Teachers are more likely to enroll their children in preschool, attend parent-teacher conferences, PTA and PTO meetings, and school events. Caregivers are also more likely to volunteer in the classroom and talk with their children's teacher. Let's take a few minutes to give you a visual timeline of research and quality at Parents as Teachers National Center. This timeline details how we got to the quality measures, outcomes, and demonstrated results we have just explored. Parents as Teachers began in 1981 in Missouri as a pilot project for first-time parents of newborns. Recognizing the program's benefits and cost-effectiveness, the Missouri legislature provided state funding in 1985 to implement Parents as Teachers programs in all Missouri school districts. Since then, Parents as Teachers has expanded across the United States and 6 other countries. The first evaluation of Parents as Teachers in 1989 in Missouri found positive impacts on parenting and child development. In 1993, an RCT in New York found reductions in child maltreatment and improved economic well-being. Results from an RCT in California between 1996 and 2001 showed positive but modest effects in parenting, child abuse neglect prevention, economic self-sufficiency, and child development. And in 1997, Parents as Teachers National Center and researchers at Washington University in St. Louis launched a research and practice partnership to integrate healthy eating and active living in the home. In 2000, the seminal Packard Foundation study posed the question, what actually takes place during a home visit? This spurred development of PAT implementation standards. In 2002, a study in Missouri found positive impacts on school readiness. In 2003, the first set of PAT quality standards were published. In 2003 and 2008, the Integrating Healthy Eating and Active Living study showed positive effects on improved dietary behavior. In 2007, researchers Sweet and Applebaum reviewed Parents as Teachers evidence on behalf of the National Center and determined a more intentional focus on quality was needed. In 2009, an RCT in Ohio demonstrated positive effects in child development. A lot happened in the 2010s. In 2012, essential requirements for model fidelity were established along with updated quality standards and a more intentional process to assess fidelity and quality. In 2014, we began a pilot program with University of Southern California's School of Social Work, pairing the PAT model with USC telehealth. In 2015, an RCT in tribal communities found positive impacts on parenting, home environment, and child development. In addition, we launched the Quality Endorsement and Improvement process and a family-level data collection and service documentation system. In 2018, findings from an RCT in Missouri and a study in Connecticut both found positive impacts on prevention of child abuse and neglect. Findings from 2 other RCTs were also published in 2018. One found positive effects on dietary behavior home environment, and diabetes, while the other, from Zurich, Switzerland, showed positive impacts on parenting and child development. In 2019, a study in Arizona found positive impacts on 3rd and 6th grade standardized test scores, suspension, and attendance. Results were also published of the feasibility study focused on model fidelity for delivering PAT via a university-based telehealth platform. They found the pilot was able to meet or exceed fidelity measures. That same year, a new evidence-based clearinghouse was established called the Prevention Services Clearinghouse, which deemed parents as teachers well supported its highest rating. Lastly, the National Center inaugurated a research council comprised of top research experts in the field to advise on the strategic direction for parents as teachers' research and learning agenda. This brings us to the 2020s. At the beginning of this decade, Parents as Teachers updated the quality standards, publishing the 3rd edition with a strengthened connection to research. In 2021, longitudinal findings from an RCT in Zurich found positive biological effects on the mental health and brains of children. In 2022, findings from a COVID-19 study found that families enrolled in Parents as Teachers had less stress. And in 2023, results from studies conducted by James Bell and Associates found positive outcomes in family economic self-sufficiency, child health, child development, parenting, and prevention of child abuse and neglect. The cumulative research and evidence outlined in this timeline led to the publication of the expanded PAT model goals in 2023. Lastly, findings released in 2024 from an RCT in Arizona found positive impacts in parenting, child development, child health and safety, and caregivers feeling more hopeful. We are also engaged in intentional research partnerships focused on specific issues. These partnerships are designed to gather recent research and perspectives from Parents as Teachers affiliates and families that then drive development of model improvements and tailored service packages. Tailored service packages contain advanced training, curriculum materials, and model implementation resources. Our first of these research partnerships, with Brazelton Touchpoints Center, focuses on supporting families prenatally and postpartum. Our second, in partnership with Tufts Interdisciplinary Evaluation Research, focuses on supporting affiliates working with families involved with the child welfare system. Several other model improvement and tailored service initiatives are also underway, including integrating doula services, as well as supporting and engaging fathers, supporting families negatively impacted by substance use, and supporting healthy identity formation. So what's ahead of us? That's where you and other members of the Research Council come in. The Research Council's overarching purpose is to support Parents as Teachers in continuing to thrive as a leader in evidence-based home visiting. To this end, Research Council members advise on and support the research and quality agenda of the organization, determine ongoing research and evaluation priorities for Parents as Teachers, and help identify and explore potential research opportunities and partnerships. We look forward to your input and consultation as we continue into the future. Thank you so much for taking the time to watch this orientation to the Parents as Teachers Research Council. We greatly appreciate your contribution to the mission.